This presentation, entitled Twin Cities Vulnerability, Environment, and Health, is a project through the University of St. Thomas Geography of Global Health course. The goal of this project was to create maps of vulnerability and environmental quality in the Twin Cities using ArcGIS. The purpose of this study was to determine the areas of the Twin Cities that are most vulnerable and the areas that have the best and worst environmental quality. From the correlation between vulnerability and environment, we can generate insights relating them to health implications and overall injustice in the Twin Cities area. Specifically, the environmental quality of an area has shown to impact the health of individuals. The idea of nature deficit disorder hypothesizes that individuals, children in particular, are not experiencing the natural world as much as their ancestors did. Lack of experience has shown to have detrimental effects on individual education and health. Biophilic design and green facades allows urban environments to integrate aspects of nature into building components. Making a more natural space has shown to benefit work and hospital settings. Finally, trees are very valuable for environmental health, but their pollution removal qualities has saved many lives. Although not an official disorder, psychologists like Richard Louv recognize that humans, especially those in urban environments, do not engage with nature as much as their ancestors. Louv indicates that this deficit has negative effects on education and health. For example, students in environmentally based education outperform peers in traditional classrooms. Science test scores increased 27% when schools adopted outdoor science projects. Also, researchers found a reduction in ADHD diagnosis when children are engaged in nature often. Contrarily, when outdoor activity declines, there is an increase in individuals with vitamin D deficiency and myopia. Similar to the biophilic argument, Louv found that there was an association with higher neighborhood greenness and slower child body mass increase. Unfortunately, many school designs discourage nature with windowless classrooms, banishment of animals from the classroom setting, and limited recess and outdoor activity. Biophilic design is an innovative way of designing the places where we live, work, and learn. Humans are inherently tied to nature in a deep and fundamental fashion, but we have often designed our cities and suburbs in ways that both degrade the environment and alienate us from nature. By reintroducing aspects of nature into architectural design, many positive results may be seen. Judith Heerwagen from the University of Washington explains that nature's benefits are intuitive and emotionally tied. Contact with nature is not just an amenity, but our evolutionary background depended on contact with nature, and that dependence is still powerfully responsive. Work environments that have adopted biophilic design have shown more relaxed but more productive employees. Even outside of work, biophilic design components have improved mood and reduced stress. Heerwagen states that enhancing the individual connection to nature is necessary for creating sustainable mentality, conscientiousness, and action towards environmental improvement. Hospitals have also benefited significantly after integrating these design concepts. Patients were shown to recover faster, have less pain, and used fewer analgesics when their rooms were brightened by the sunlight and they had access to natural scenes. Mark Otelli agrees that connection to nature on a daily basis reinforces the values of respect and care for the environment. His research shows that vertical greenery has more than just psychological benefits. Green facades insulate buildings by reducing ambient wind speed, contribute to increased biodiversity in that environment, and reduce air pollution by absorbing fine dust from the air that is otherwise inhaled and detrimental to human health. Plus, green facades are aesthetically pleasing to most humans, so integrating green facades into design may be inherently beautiful, yet functional. Trees are universally known for their supply of oxygen for our survival. However, they also take pollutant material out of the air, thus improving our lives. Trees intercept particle matter on plant surfaces and absorb gaseous pollutants through leaf stomata. David Nowak and colleagues estimated that 17.4 million tons of air pollution were removed from U.S. trees in 2010. In regards to economics, that saved the U.S. $6.8 billion in healthcare costs. The areas that saw the most substantial benefit from tree introduction is the urban environment. Even though most of the pollution removal occurred in rural environments that have lots of trees, urban areas saw greatest health benefits because more humans are in one area, so their proximity to trees was a determinant of health improvement. In 2005, there was approximately 130,000 particle matter and 4,700 ozone-related deaths attributed to air pollution. Even though tree cover in the United States is estimated at 34.2%, it varies from 2.6% in North Dakota to 88.9% in New Hampshire. In 2005, those trees saved 850 lives and prevented 670,000 incidences of acute respiratory symptoms. For my study, I mapped vulnerability and environmental quality in the Twin Cities 7-county metro area surrounding Minneapolis and St. Paul. This map shows that metro area from where the data and results were projected. My research question focuses on the health risks associated with demographic vulnerability and access to environmental amenities. Are there areas in the Twin Cities where vulnerability is correlated with limited access to amenities? If so, what are the health implications and consequent injustices initially related to vulnerability? The first component of the map was demographic vulnerability. Based on previous research and using data from the Census Bureau's 2010 American Community Survey, I defined vulnerability with 4 components. I was particularly interested in children aged 0 to 19 and their vulnerability in relation to their parents that didn't have bachelor's degrees, their poverty, and their neighborhood quality based on vacant houses. This is the vulnerability map I created that was used to visually represent the vulnerability components through GIS mapping. As mentioned, 4 variables were selected in order to define vulnerability in the 7-county metro area. Using the feature to raster tool, numerical data in the American Community Survey shapefiles were converted to rasters. The variables that were originally numerical data were converted to percentages of the total population. Rasters were classified so that all data would be on the same scale. We used the raster calculator tool to make an equation that combined all components to one map. Percent in poverty was deemed the most important factor for vulnerability and therefore was counted twice. The resulting vulnerability map shows a spectrum of vulnerability in the Twin Cities area. Areas in red indicate the most vulnerable places in regards to children, poverty, educated adults, and vacant houses. Areas in green show the least vulnerable populations in regard to those 4 components. Cityscape icons show the downtowns of Minneapolis and St. Paul. Most vulnerability appears in swaths around these downtowns. Surrounding the city and in suburban settings, there is less vulnerability until you reach the farmland and outer regions of the 7-county metro area. I also analyzed environmental amenities in my project. I defined environmental amenities in relation to recreational and urban natural space. I used data from NCLD 2011 and Metropolitan Council's Lakes and Rivers data, Parks and Recreation data, and Land Use 2010 data. I chose 5 components to represent environmental amenities, which included trees, undeveloped land or open space, lakes and rivers, regional trails, and parks and recreation space. This is the model I used to create a map which shows access to environmental amenities in the Twin Cities. Using feature to raster, I created a cost raster which assigned values to land features based on their potential for mobility. From there, the cost distance tool was used to determine how easy or difficult it is for individuals to access undeveloped space, parks and rec, and regional trails based on their proximity initially. Here you can see in detail how the cost distance tool calculates the least cumulative cost to travel through each cell to get to the nearest source. As described, the feature to raster tool created a cost raster that assigned a cost to each cell as shown in the multicolored table. Cells assigned a 1 indicated the area is easy to travel through, like a road or highway. Higher numbered cells are more difficult to travel through, like lakes or swamps. The resulting cost distance tool then indicates the cumulative difficulty that someone may have when traveling from one cell on the map to the source, which in this case is environmental amenity. Cost distance maps were reclassified so that all results are on the same scale. Then standardized data was input into the raster calculator. Access to trees, lakes, and rivers were considered negligible because individuals may not travel to a tree or water for recreation or health benefits, but proximity to them has health advantages physically and psychologically. Access to regional trails was considered least important in relation to the other components, since regional trails limited the data to only a few trails in the metro area, and other recreational options were more representative and likely for vulnerable populations. In the resulting map showing environmental amenities, red areas indicated where there is less environmental amenities, and green areas indicate more amenities. The result is almost a spiderweb effect, due to the many lakes and rivers running between and around the 2 downtown city centers. Still, some access difficulties are present around the city centers, and suburban lands seem to be characterized by average amenity access and better access over a larger area compared to city centers. To complete this study, I analyzed the correlation between vulnerability and access to environmental amenities. This correlation was analyzed on a municipal and a neighborhood scale. A strong correlation on either scale would show that vulnerable areas are also likely to have poor environments. Consequently, we could draw some implications regarding the justness of the area, considering the health effects related to environmental quality. A weak correlation could mean that the Twin Cities area opposes the national data that says that vulnerable people usually live in worse environments. Alternatively, weak correlations could reveal a disparity between municipalities and neighborhoods. What happens on the municipal scale may not be true on the neighborhood scale, since municipal boundaries are set to encompass diverse populations and environments. This final model includes the environmental amenities model, the vulnerability model, the raster calculation comparing the two, and the zonal statistics models on the municipal and neighborhood scale. This map shows the result of the raster calculation that combined the vulnerability map with the environmental amenities map. The red areas indicate hotspots where there was the most vulnerability and the worst environmental amenities. Green areas show the places of least vulnerability and most amenities. This map appears to reiterate the story that areas near the downtowns are worst, while the suburban areas surrounding the city are best. When compared to the vulnerability and amenities maps individually, the combination map appears to emulate the vulnerability results more than the environmental amenities map. Visually, though, the amenities map appears to have a similar underlying theme with more concentrated red or worse areas near downtowns and green or better areas in the suburbs. In order to find the correlation between vulnerability and amenities, I used zonal statistics on the municipal and neighborhood scale. The neighborhood scale was comprised of neighborhoods only in the Twin Cities and did not include the entire 7-county metro area. Using ordinary least squares, I compared these two variables based on mean values from the zonal statistics table. On a municipal scale, there turned out to be little correlation between vulnerability and environmental amenities. As indicated by the scatter plot, only 10% of the data showed a correlation between vulnerability and amenities. Although the 7-county metro area appeared to show similar hotspots, the two municipality maps are evidently unrelated. You would think that the reason a low correlation was found is because municipalities include rich, poor, more and less vulnerable people all in the same area. The same goes for access to amenities. Municipalities include good and bad environments in the same area. This idea is good for politics and ensuring accurate representation. However, it may give an inaccurate representation of the correlation between vulnerability and environmental amenities. If you look at the relationship on a smaller scale, like the neighborhood scale, that may change the story and show a greater correlation between vulnerability and environmental amenities. Based on national statistics, we can predict that the more vulnerable areas will have worse environments. This is partially because poor people must live in cheaper housing, and housing values decline when an area lacks environmental amenities. Upon zooming into the neighborhood scale, there is even less of a correlation between vulnerability and environmental amenities. In fact, there is a negative correlation on the neighborhood scale. This result opposes national data and negates the theory that municipal boundaries inaccurately represented reality. A negative correlation tells us that with respect to the chosen components of vulnerability and environmental amenities, Minneapolis and St. Paul are fairly just cities. Vulnerable people are as close to environmental amenities as non-vulnerable people, which is good news for the Twin Cities. By looking at the environmental maps again, it becomes clear that the geographic location for the Twin Cities favors proximity to amenities, whether in the city or the suburbs. For instance, the Minneapolis River winds through both city centers and lakes freckle the landscape. Also, Twin Cities representatives were proactive in establishing parks and recreation sites around and alongside water sources, which contributed to the encouraging results discovered in this project. To conclude, it is necessary that we understand that the results of the study do not mean that Twin Cities has little vulnerability or that the environments are great across the 7-county region. Very vulnerable communities and very unfavorable environments do exist in this area. However, in regard to the components I chose to define vulnerability and environmental amenities, the Twin Cities performs quite well. In terms of justice and health, the vulnerable populations have relatively similar environmental quality compared to the less vulnerable populations. On multiple scales, we find agreeable results, which is good news for the Twin Cities, and it follows with the uniqueness of the Twin Cities landscape compared to other cities. My research was limited by my definition of vulnerability and amenities. Future research may define these two variables differently, and subsequent maps may show stronger or weaker correlations based on the components that the researchers use to define those variables. It may be valuable to explore many options and definitions in order to get a better understanding of justice and health in the Twin Cities. Other possible components for vulnerability could be crime, median income, and the elderly. Some amenity definitions may include bikeways, or they may only consider trees as amenities. Future researchers could benefit from adding variables that relate to health and justice. An access to emergency services variable could show distance and cost distance to hospitals and fire departments. An environmental disamenities map could show areas where people are close to bad things like sewage treatment plants, disposal sites, or hazardous material plants. Also, other studies have shown that the increasing temperatures in urban environments relate to health. Studying tree cover in relation to urban cooling or imperviousness in relation to urban heating may add a unique variable to a map of overall justice in the Twin Cities. Finally, comparing the Twin Cities results with other cities on the national statistics would enhance understanding about the Twin Cities' performance in relation to various components of environmental quality and vulnerability.